Good morning, everyone. I'm Jay Christopher Watkins, Executive Director of Training and Technical Assistance Services at Western Kentucky University. Our presentation today is around the idea of the COVID-19 one-time funds and what your program may need and the possibility on funding. This presentation is very short, I assure you, and it comes out of the Office of Head Start's presentation on caring for our children in group settings during COVID-19. There was a lot of information in that presentation, and we want to remind everybody to make the use of that when considering what they might be needing in terms of one-time funding, because one-time funding for COVID-19 is available and is due May 15th. What needs to happen is the program needs to sit down as a management team and decide what is my program likely to need because of the coronavirus. OHS gave us the caring for children during in group settings during COVID-19. It's available on demand starting April 24th. You can register for the on-demand presentation at the site that's been listed here. There's a lot of information in here, and unfortunately many of our fiscal offices did not get a chance to listen in or view the presentation, and that's the reason that we're presenting this. The bulk of the information does come straight out of OHS, and it would be very, very useful for programs to take a in-depth look at what they might be needing. OHS is still trying to maintain maximum flexibility for the local programs. In other words, what may work in one location may not work in another location. What they're trying to avoid is issuing blanket guidance, because what is likely to function well, say, in Texas may not function so well in Illinois. What functions well in Kentucky may not function at all in Tennessee. So what OHS is expecting all of us to be doing is staying in contact with our state and with state licensing and our local health departments about what childcare may look like in the very, very near future. And as a result of that, they had a number of things that they asked programs to consider, and that's why they said consider. They can't tell us that. They can't actually tell us exactly how things are going to look. So what they're trying to do is provide as many possibilities as they can so that we are cognizant of what is likely to be coming down the pike again in the very near future. The health team zeroed in on quite a few points. First one was about group sizes. Group size not to exceed 10 for all ages. Ratios naturally will follow state and local health department guidance. Strictest rule still stands. The aim here is to keep the group size and the staff ratios as low as is possible. Stable groups of children. So children from the same family in the same group, regardless of age. The idea is to limit the mixing of the groups. Again, the idea behind this is to cut down on the potential exponential growth of potential virus contacts. OHS wants us to use the term physical distancing, but socially engaged, rather than call it social distancing, which is what we've all learned to say now. Being socially engaged from a distance will be kind of interesting to see in the classrooms, but okay. The classrooms themselves, additional indoor square footage, the standards say 35. The recommendation right now is 42 to 44 per child. They suggest that we remove some furniture, storing it out of the classroom to provide more usable space, and trying to keep space between the children and the uh, teacher or child care provider. It's very hard to do with the young kids, so this is going to take some great deal of creativity on the part of our teaching staffs. Number 5 is to reduce clutter, not to have shared toys. Once a toy is played with, then it goes into a bin to be cleaned and, depending on the item, possibly disinfected. Parallel play, no items coming in from the home. Again, the idea here is that we're trying to limit any surface that might be coming in that could be holding the virus. If a child becomes ill, we've got to have a space or room uh, where we can remove the child and keep the child. Uh, let's be careful on the concept of isolating. Uh, Total isolation. Please be careful here. We cannot lock the children up in closets or cupboards or things of this ilk uh, and call it isolation. If the child or staff member becomes ill, then uh, we need to know what to do and what your local health department is recommending prior to any of this taking place. Does the whole school get quarantined? In some locations, they may be advising shut down the whole thing for 24 hours, disinfecting, then opening, or is it just a classroom within the center? Again, this will likely differ depending upon whether it's a child that gets ill or whether it's a staff member who has greater access within the center getting ill. So we need to have those conversations among many with the local health department prior to reopening. Masks for adults and any child over the age of 2. The health team has noted that this is going to be difficult to do. That children are not going, generally speaking, children are not be comfortable with the masks. But deep down, masks to prevent droplets from coming out of everybody or anybody's mouth is the aim here. Watch the airflow and ventilation. Now we're into facilities and things we never really thought we would talk about. If at all possible, have good ventilation and airflow. Be careful when you do start providing airflow, opening windows and things of this nature, of how the air is flowing through the building, how the air is flowing through the rooms, and potentially what impact could that have in terms of being a vector point for virus. Again, this is way out of my depth, but based on some studies that have shown people being cross-contaminated in restaurants, it is important for us to pay attention how the air flows within the classrooms, and then the procedure for surfaces, playground equipment, and most materials is to clean first and then disinfect. They don't require sanitizing. Again, check the Caring for Our Basics for their recommendations on what gets cleaned and disinfect, and what gets cleaned, disinfected, sanitized, or what gets cleaned then sanitized. Because again, as I've said, this is a little beyond my realm. Drop-off and pickups. Can't have large gatherings anymore. Can't have lines anymore. If you have lines, they're going to have to be 6 feet apart. That means that staff are going to have to be there for the lining up. Uh, it's recommended that the lineups be done outside. Hand sanitizer where the child is being signed in. This would not be hand sanitizer for the child. This would be hand sanitizer for the adult. The adult would get out, bring their child up to the access point, uh, sanitize their hands, sign their child in using their own PIN, and then the staff would take the child from that point. Clean smocks for teachers, change of clothes. That part really hasn't changed. More vigorous health checks, uh, first aid. Excuse me. Uh, Taking temperatures. First, actually multiple temperature checks. The first as the child is approaching the entry point to the facility. Uh, if the child has a dry cough, trouble breathing, or fever over 100.4, then the child's not coming into the facility. We're going to be taking temperatures of staff and children multiple times throughout the day. When they're in our facilities, we probably need to go ahead and order up a slew of no-touch thermometers using the COVID-19 dollars. But the taking of temperature will be something that will be done repeatedly, so we might as well get used to that. The CDC has provided 3 different ways to screen a child before they enter the center. Partly done at home. We give the families a thermometer. That means we've got to order even more thermometers and teach them how to use it. Staff stand behind some sort of plexiglass barrier and observe the child and take the temp, or the staff screens the child wearing a mask, wash hands, clean gloves. When you're doing this, though, people aren't going to be 6 foot apart because you can't screen the temperature and be 6 foot apart. The plexiglass barrier appears to hold some merit in this, but again, having the plexiglass structured in such a way that it's usable for the adult to take the child's temperature may require a certain level of creativity. We're still using bleach for disinfecting. We're still doing the disinfecting of the diapering areas, the diaper baskets, high touch areas, door handles, things of this nature. And then 16th item, give more outside time if possible, but keep 6 feet between children and staff if possible. Ideally stagger the outdoor times so only one group is on the playground, and then disinfect the outdoor equipment between groups. That part is critically important, I've been told, because ultimately the virus can live on surfaces, so we've got to make sure that the surfaces are cleaned before any child is using them or is exposed to those surfaces. And when I say cleaned, I don't just mean washed. I mean possibly washed and disinfected. Toothbrushing is suspended. Food not going to be prepared by the same person who diapers the children. Mealtime, children sitting 6 foot apart, and individual plated meals, no sharing of utensils. Try to encourage conversation. One of the things the health team asked me definitely to bring up with those distances, the conversations that will be had will kind of be interesting, because in essence, staff are going to find themselves ultimately talking very loudly at some points. The physicals, they still need immunizations. They're still going to need the physicals. The health team was very, very adamant that I had to bring up the fact that physical distancing and adult-child interactions is likely to have an impact on class scores. So do consider that. That's not necessarily going to have a budgetary impact for the program, but it is definitely going to have impact in terms of child development. And again, a series of brainstorming sessions around playground activities as well as classroom activities that seem to be working well, and which ones turn out to be disaster, because this may be ever evolving list. I apologize for that. Evolving list as to what might be needed and what activities go well and what activities just really do not work. A word on face masks. Cloth masks might not be necessary if we can keep the children and staff apart 6 foot at all times, but the minute you start violating that, you got to have the masks on. Masks not to be worn while exercising, but the reality is that in some locations, such as Kentucky, the governor has already ordered that people will be donning masks starting in May, and this is likely to continue. We're not sure when it's going to end, so this is likely to continue. So again, we have the word about face masks and that they might not be necessary, but on the other hand, local health departments or state licensing or the state health may be telling programs, as well as other child care providers and other organizations, that yes, you will be wearing masks. This was a rapid run through. As I promised, I was going to keep this short. The webinar is available online starting today. This is something, going through the webinar and taking notes. The health team did a very nice job capturing notes that they thought would have implications for classroom observations, classroom services, and ultimately budgetary implications. If you need to see specific slides from the webinar, we have those available. They won't have the audio with it, but the slides themselves are available at our website. And remember, the one-time supplements for this COVID-19 are due into the Office of Head Start on May 15th, so that doesn't give us a whole lot of time to be considering these things, but this is the time in which we are expected to be considering what we may be needing for the near future. Thank you for your 17 minutes of attention on this, and good luck. If you've got questions, please do not hesitate to contact us. It could be a health question, it could be a fiscal question, it could be a direct service type question. We're here. Remember, we will get through this, and we will get through this together, as my governors want to say. So please, if you have questions, do contact. And here's how you would contact us: office hours, phone numbers, website, and the standard email. So thank you, and please check out our complimentary resources that are updated, and we hope you find this useful, or at least something worthy of consideration, because quite honestly, we're probably looking at some massive changes taking place. Some will work, some won't work. We'll have to learn from what doesn't work. And quite honestly, how the program functions in the starting fall is probably going to look very different than how it started last fall. So thank you for your attention, and good day.